Dear all, welcome to you all to this podcast. Today we have a very renowned scientist, engineer and business executive, Mr. Omar. He is an Bangladeshi-American. That's right?
That's correct.
Yes. Okay, thank you. And Omar was the former chairman and CEO of the Medtronic, the biggest company of the world. It is device-related company, medical device-related company.
Yes.
And he has a good relation with the Bangladesh. And he wants to make a collaboration between the America, especially through the Medtronic and Bangladesh peoples as well as the government, through the government. And he did a lot, as I can remember that, during the COVID time, he gave some ventilation and ventilator machine to the Bangladesh people. And also he has made some infrastructure changes of the Medtronic business in Bangladesh, and that added the value of the healthcare system in Bangladesh. Thank you, Omar, for coming to this podcast, healthcare podcast meeting.
Thank you. Thank you.
So I will say in a simple way, how can we proceed on? I will tell you in Bangla as well as English. Whatever you like, you can say like that. So the challenge of Bangladesh that we have an 180 million population, but this is the one negative point, and we have a less number of the area of the living. This is biggest hazard for us, but we have biggest advantage that 2/3 of the people in Bangladesh are active, that is they can work, not like in Western countries or other countries. And so most important part in the world now is that healthcare system has to develop to make a man healthy both physically and mentally. But in Bangladesh it is less addressed. I will say that even the parents less addressed for that. In China I heard that they said that our priority is the first health, second is education. But in our country, no priority of the health, only education and work, only education and work. What do you address of the philosophy of these Bangladesh peoples?
Well, let me start by saying that you may say that, but to an individual, the healthcare is indeed a priority. For
Yes.
you and me personally, for any person who's living, for their families and for themselves, it's a priority. Whether there's a priority within the government and so on to establish a healthcare system may be one that you can debate, but it's surely one that every government cares about because it affects the people. So it is one of priority. At the same time, it's not something, it has to be something that has to have a clear outcome, that has a clear benefit. The cost has to be something that a country can afford, and access has to be provided to people. So let me start therefore by saying that healthcare can be improved no matter what country you're in, and everyone does care about it, and everyone wants to make it better. So with that, maybe I can follow up with any thoughts you want me to take.
Okay, thank you very much. But we have a biggest constraint that we have not structural insurance coverage to our patients. That is the biggest challenge for them. Patient has to pay the doctors directly, hospital directly. And again, when the patient come back, again, they have to pay the same. But patient does not understand what system we are adapting now. So you have been, I have seen your some interview or some broadcast in a paper that the value healthcare system. What is that?
Yeah, first you have to acknowledge that I understand the constraints here, but this is not the only country where healthcare is not available to everyone. And if you look at it that way, in every single country in the world, developed or not, there are issues which people want to make better, both in terms of access and often in terms of cost as well. Value-based healthcare is a concept that's been around for a long time, and its basic principles are fairly obvious, but it's been very difficult to implement, and it's really never been implemented. The basic principle of value-based healthcare is that one gets paid for improving an outcome of a patient. At the highest level, that is a very simple proposition, because I think you'll agree that if someone's health improves, if they were dying and they get cured, or they live longer, I think in most cases people will find a way to pay for it, even without insurance, because one's life is the most important thing that one has. Much more important than money, much more important than anything else. One's life is the most important thing. And value-based healthcare is a method through which compensation of the healthcare system is done in a way that extends lives or improves outcomes. It's easier said than done. And I can go into that depending on which way you're directed to, but essentially it's a philosophy that can be applied to any country, developed or underdeveloped, The advantage that a country like Bangladesh has is that because there is no system that exists today, you can develop a system that's based on that, but let's not simplify it too much. That has to be worked on, there's to be a consistent approach, and there's to be an understanding and dedication towards that. But Bangladesh does have an opportunity to be able to develop a system which is based on value, because one doesn't exist, so nothing has to be changed.
That's fine, but if there's nothing said, you can make it very scientifically, very designed with it.
But how do you do it? That's the question.
But how to do it?
Yeah.
How government can adapt it, that's important.
Well,
and
yeah.
you said that value healthcare, but it was started first announced by the Michael Porter
Indeed,
in
yeah.
2016, but it is not becoming popular throughout the world.
No.
As a physician, I don't know it. I
Yeah.
heard from you for first time in
Yeah.
Bangladesh.
Yeah.
So why? So what is the constant is
Yeah.
left behind for that?
Well, it's actually the concept was probably even earlier than 2016. That's when maybe it was made public. But I've personally given it a lot of thought. And the constraints are different, but one of the main things that one has to recognize about value-based healthcare is that it's granular. It's improving outcomes, and by definition, if you improve the outcomes, you will lower cost. Okay, that's something that people miss, and one of the biggest issues, in my view, that governments around the world have is that they think of cost and they don't think of return in investment in healthcare. And actually, you've got to think of what value you're creating. That's what the return is. And if you create enough value, you'll actually lower cost. If you improve someone's outcome, if someone lives longer, they use less of the healthcare system, that's lower cost. Now, the only issue with this is that there's a big time gap between when you recognize the value and when you lower the cost. And to do the immediate thing, you've got to do some investment. But the investment that I think most countries miss is that when they do the investment, they're not linking it to the ultimate value creation. And there's no then process through which that's followed. That's not happening because in most countries in the world, an existing system is already there. And to change that existing system makes it very difficult.
It is very difficult.
Yeah.
Understand that.
So let me then, in a very simple way, try to explain, what it takes and some basic ground rules. The thing about value is that it has to be granular. It has to be granular because it's outcomes over cost. So let me see how you do that. Well, the first thing, if you want to pay somebody on outcomes, you've got to be able to measure the outcome. It has to be quantitative. It cannot be a survey. It's got to be a real outcome measurement, which is scientifically consistent. That's the number one thing. Number two thing is, as you know, in healthcare, even for a specific condition or a specific disease, the nature of the cohort will determine the outcome. An older person will have a different outcome than a younger person, and so on and so forth. And so the cohort must be understood that's linked to the outcome. So that's very established in the healthcare community, but it's not translated into operating a healthcare system, but it should be. The third thing that you've got to sort of be concerned about in developing a value-based system is who are the stakeholders involved in achieving the outcome. And when you identify that, you've got to ensure that all the stakeholders are paid based on the value that's created, on the outcome that's generated. This sounds simple, but to execute it, one has to be granular, one has to know who's doing this, and also if people are already being paid in a certain way, to change it is not simple. So understand this.
Yes, I understand.
If the outcome is not reached, if there's a mistake, someone doesn't get paid. That's not today's world. At the same time, if the outcome is reached, you do get paid, and maybe you get paid more.
Okay, I can give
think
you.
it that way. Yeah.
But with the interruption, I can give it one best example.
Sure.
Suppose if the patient come to me
Yeah.
or even in hospital
Yeah.
and having a heart attack.
Yeah.
I do the primary PCI
Yeah.
if the infrastructure is there.
Yeah. Yeah.
So patient has to pay a lot of the money.
Yeah.
But at the end of what happened? Patient survived and
Yeah.
patient heart pumping is preserved.
Yeah.
So he can go back home within a couple of days and
Yeah.
work.
Yeah.
That's why that is got that may be the translated with health.
That's correct. And I'm telling you, that patient and their family, you've survived that patient's life, is not worried
Yes.
about paying you money for it.
Yes, exactly.
So the money is important. I'm not diminishing that. But when you create a value, when you know what you're paying for, there's a way to fund this. And in the end, if you improve outcomes, actually the cost goes down because you don't have to go back to healthcare.
Yes,
and so you have to have
exactly.
that philosophy, and it has to be long-term and consistent. And unfortunately, in today's world, especially in countries with established health-based systems, the payment mechanisms are already established. And now when you tell them you'll only get paid if the outcome is reached, and they get paid anyway right now, they don't want to change. So
Yes.
it becomes very difficult to change. Now, there are some projects going on and some successes, but to translate an entire system to this requires a lot of work. And I do think that in a place like Bangladesh, where an existing system really doesn't exist, if you want to create one from scratch, do it this way, a government system.
So we can address that in Bangladesh as the insurance system is virgin or
Yeah,
there is no.
Yeah.
I will not say that there is no healthcare system, there is
No.
a healthcare system,
Yeah.
but it is not well established. So
Yeah.
this is the country where we can address this value-based healthcare
You can
system.
at least take this into account as you establish the system. So that's one point that's important. And then, but you've got to have a strategy around this, and that's more than I can just describe here. And it's very, I don't have all the answers. I just know the philosophies. But it's something that one should work on with that philosophy in mind and kind of figure out how to do this. It should
Okay.
be a factor in
I think
developing
so.
healthcare
As I can
systems.
remember that during the COVID time, we have a Zoom meeting for the insurance and healthcare system on the Zoom platform. And I am sure that you are working with the government for this project. You are discussing with the government because present government, you have good relations with present government. Did you have an penetration with the present government for this system?
No, we didn't really talk about value-based healthcare. The ventilator thing was just a matter of, it was
So,
the crisis was so much to put ventilators in, and we were trying to figure out how to do it, if I recall correctly. But we didn't really discuss in depth implementation of a value
But that is
system.
very important.
It is.
But
It
we
is.
should.
But I think there are other aspects that one has to think of. I mean, that's one. That's just the value-based healthcare essentially goes towards a payment mechanism. Okay, that's not the only thing. You will decide how you implement healthcare. And one of the biggest things that I think one has to consider, especially in a country like this, is a statement that I've learned to use is that, hospitalization is actually a failure of medicine.
Exactly.
And so trying to create a healthcare system that's based on building hospitals is not the right approach. So what should that approach be? I think that strategic thinking about how healthcare system should be created, what the priorities should be, is actually much more important and earlier stage discussion than the value-based system, which is simply the payment mechanism. So understanding what the priorities are is actually very important. And I can discuss more about that.
Okay, no, thank you very much.
Yeah.
Because if we put all the patients in the hospital,
Yeah.
so many hospitals,
Yeah.
108 million populations, and putting them in the hospital,
It doesn't
coming
work.
back, go home, and coming back again. So
Exactly.
all the resources
Yeah.
will go to.
Oh, it's not only that. As
My-
the specialty that's required to treat a certain condition in healthcare is very granular. As you know, a person doing a PCI doesn't necessarily get trained to put a pacemaker in, and they're both in cardiology. Forget about cancer treatment, that's completely different. Or neurology, that's completely different again.
Complete differences.
Yeah, so, and you can't have all hospitals built which does everything 100%. It's impossible. You have to focus in certain areas and prioritize. So hospitals are the last stage, like I said. It's pre-hospital healthcare system where you prevent escalation of disease, which is where this country should focus on first.
That is very important. That
Yeah.
part is less focused because we have to take care of the primary prevention.
Yes,
Prevention,
to reduce
prevention,
the amount that
reduce
goes to the hospital.
Suppose we have some now non-communicable disease in Bangladesh.
Yeah,
Government
yeah.
has been very successful
Yeah.
in the communicable disease, and our polio and the
Yeah.
other thing disease
Yeah.
decreased significantly in Bangladesh, and we can proud for that in Bangladesh
Yeah.
government, on behalf of Bangladesh government.
Yeah.
As a healthcare provider, I also can proud for that. But regarding the prevention of the non-communicable disease is a big burden for Bangladesh now.
Well, I think there's two factors here which are very important, which a country like Bangladesh has to pay attention to. As the world develops and as the country develops, there's some things that happen which you have to be very careful with. One is with development in rural areas, automation comes in. So someone who's been, pushing farming equipment and all of that now goes in a tractor to move less. Okay, there's less activity. The diet stays the same, but the activity is less. Over a period of time, that's going to be a problem. As you know, if you work less, if you move less, you should adjust your diet. They're not doing that. That's a good thing. They just need to be educated as to what to eat and all of that. You're also getting all kinds of, snacks and food and all that, which a normal farming rural community is not used to. Packaged food and drinks and all of that, which a rural community is not used to, which have got different kinds of more sugar and all of this. And again, that's adding to a problem. So the risk of escalating chronic disease is quite high. And as you know, with chronic disease, the symptoms don't appear till it's very late. And if it's detected early, it can be caught early. So I do think in prevention of healthcare, early stage detection, coaching, behavior change in this country where people are still young is very important. As I'm sure you'll agree, you want to sort of coach people to have the right behaviors when they're young, By the time they're old and have symptoms, and you try to fix it, you probably can today, but it's much harder and it's much more difficult. So you want to catch these as early as possible. So a thought process around prevention, and early stage detection, and therefore coaching, it can be done. And in today's world, the way technology is going with AI, with information, the way it's moving with technology, detection technologies, and all of that moving, these things can be done. And I think the country's focus in healthcare, in my view, should be early stage prevention and specialization of certain areas and in hospitals, because you can't do everything, is the way I think you should do it. You should have some general hospitals, but specialization in disease states that are most prevalent is important, but far more important than that is early stage prevention. And I don't mean in prevention like no disease to some disease. There's layers of that. There's people with early stage disease, you're going to treat them differently than no disease. People with a little later stage disease, you're going to treat them again differently. And you're going to have these cohorts, and you're going to see what the biggest issues are, and you're going to treat it. So I think these things can be done, and technology should always be viewed as an asset that one can use to achieve this goal.
Thank you very much. Thank you, Omar. Thank you. I think so we can translate all these messages to our common people as well as the healthcare providers. So value-based healthcare system is a good system. We can adapt that, and focusing the patient on the point, because our intention is treat the patient and patient outcome and the family.
Yeah.
And the money he is expending, we have to explain that the money you are expending, it is not it is important for you. It is not. It is important for you and your family and your life.
And if you get an improved outcome from that, you'll actually be okay.
It's okay, and you can earn more money.
And more money.
And that's fine. You can good family life. Yeah. So thank you.
Let me just add one last thing that I think is important to recognize. As you do this, I think a systematic approach is important, because one can say that you're talking about prevention and all that, but today you get crowds of people coming into a hospital, and you can't change that overnight. I know that. But even when the crowds come into the hospital, you can manage those people differently. You can organize cohorts amongst them. You can then send some home early, instead of everyone waiting to see the end doctor. So there's ways of managing this. So I think a systematic approach should be done. And the one thing that I'll finish with is that as you design a systematic approach, in every action that you take, in every investment that you make, ask the question, whatever I'm doing, how does it improve an outcome? Just ask that question, and get a line of sight for whatever you're doing to changing an outcome. And unless all the dots are joined through which one can improve an outcome, investing of money is not an efficient way of doing this. So that's why I go back to value-based healthcare, in the sense that asking the question, that whatever investment I'm making, what is the line of sight to an improved outcome? You've got to do that.
Okay, that's very important, and people have to understand that.
They have to understand that.
Patient has to understand that.
Yes, and so the government
system understand that, and government should have some kind of the process so that
through which that is asked and done. Exactly.
Yes, exactly. Yeah. And thank you, Dr. Omar, for joining with me. I think so. The next we will go to the next podcast.
Sure.
On the next time. So thank you for coming and joining with us.
Thank you very much. It's a real pleasure.